We're going to begin this.
Hi, I'm
Hi.
Tara.
Hi,
I'm going to be
I'm
touching you.
I'm touching your body.
Hi, I'm Tara. I'm touched. So we're going to do
Nice to meet you.
Nice to meet you. I'm going to be looking at touching and moving your foot and ankle. Is that okay? Okay, so the patient does, they're happy with that. So we begin with our what? Visual. So I'm going to have you stand here for me, please. And I'm going to have you face me and then take a quarter return that direction. Very good. Thank you. And then that way. And then one more. And then back towards me. Thank you. And then I'm going to have you walk along here and back. So that's all the patient really knows, right? There you go. You can turn on, you can come back. And so you all know that the size shape, let's just stay right here for a minute. Size shade, symmetry, swelling, subluxation, scarring. For instance, like discoloration. What could cause discoloration? Any idea?
Any sprain ankle without
Sprain.
dates.
That's right. And so what's the most common sprain? Inversion sprain. And what gets torn with that generally? Yeah, now that also puts a lot of pressure on your peroneus brevis. Does anybody know where that inserts? That's right, the proximal fifth metatarsal, and sometimes that will wind up with like an avulsion fracture will happen, or a Jones fracture, depending on what you're doing. So you're going to look at that. Now, when your patient's turning from you, an important part to look at is your arches on your patient. So you want to make sure, like for instance, the way Shelby's standing now, I can see the medial arch on her right foot, and I can see the lateral arch on her left foot. And so as she turns, I want to pick up the other arch, okay? And also as she turns, can you face that direction for me? You want to look at the Achilles tendon to see how that's coming down to the foot. It might help you, give you some clues with things like inversion, eversion. Okay, so they're the kind of things you're going to look at your patient. Some other things you might want to look at for your patient. Do they have any type of bunions? Do they have corns? Do they have calluses? Anybody tell me anything else you might see? What's that?
No.
Can you think of anything else? What's the main area people have problem with? Which toe, I guess I should say. The first toe. And so what might you see with that? You might see swelling there and signs of like a hallux rigidus, or you might see some bowing of the toe medially, like a hallux valgus. All those different things. So you're going to be looking at them on your patient, trying to determine what it is that you need with your patient. Okay. Now, your inspection can't stop here because we can't see the bottom of the foot. So you can either have your patient walk away, or you can and have them lay down afterwards, or you can have them lay down and then walk away. I prefer them to just look at them, have them walk away, and then have them lay down. So would you just lay down for me, please? And so then what you're going to do is you're going to have the patient, and when you examine the patient, you have to look even between each toe. Has everybody got that? Just separate the toes like this. You might see things in there like what? Don't say toes, man. Huh?
Sock foot.
Sock underneath toe. Maybe you'll see cracking or things, like people have things like, what do they call that? Athlete's foot, right? You might see things like a melanoma you might see in there and so on. So you really got to be careful. In fact, you see that she has this nice red polish on her toes. You need to make a note of that, because sometimes people underneath their toenails have things like melanoma. And if you don't pick that up and they come back and say, how come you didn't see this? And I don't know why I didn't see that. You know, that's why you write down patient was wearing toenail polish. Okay, just make sure you write that down. Same when you're looking at their hands, make sure you write down patient was wearing. You can see what else with the toes. You might see like clubbing of the toe or things like that, telling you there's some type of a cardiovascular issue or breathing issue that they might have. All kinds of things that you can see. Sometimes people get like a fungus on their toenails. Have you ever seen that? The toenail will turn like a yellow or so on. People will get that. So you'll see all these different things. And then after you look at the patient's foot, you always have to look at the bottom of the foot. You have to check out the soles of the foot, particularly along here. You'll see things like calluses and things, particularly on ladies, is very, very common. Okay? So everybody got that? So your inspection isn't just standing and walking. You also have to take a really close look in the patient. Any questions on that? Okay, so what's the next thing we're going to do? The supine examination. Do you have anything for your head? Here, let me give you this here. A woman cut this one. I'm fine, I just didn't have the strength. I knew one of you could. Here, okay. Oh my God.
You're a woman.
Okay. That's okay. I'm sure I deserved it. Next thing we're going to do what? Temperature and dermatome and what? Peripheral sensory nerves. Okay, so temperature. My hands are going to be a lot colder than her feet, I'll bet. You know, but I'm going to go through and I'm going to measure the temperature of the patient's feet. Right after you do that, you're going to do what? Hi. I'm going to go like this over your feet, and I'm going as I go over it. I'm going to ask you if you can feel it and if one side feels the same. Okay, you ready?
Yep.
So we remember as we come down here, we're going to say, does this feel like this?
Yes.
Yes. And what did we just test there? 4, right? And then we're going to come this way, here. Does this feel like this?
Yes.
Yes. And then we're going to come where? Here, and here, and we're going to come here and here. And that's right. That's right. Okay, now, the peripheral sensory nerves, there's a lot of them here. The one that comes over the top of the foot is what? Superficial peroneal, right? And then we actually have to do in here. Does this go like this? That is what? The deep peroneal, right? As we come down on, let's see, on 4, what would this one be? Here and here? What is 4? What covers 4? It also covers 2. It's the saphenous, right? And what covers 1? Sorrel. So that's going to come on the edge of the foot. Okay, has everybody got that? Sorrel. Now what about the bottom of the foot? Does anybody remember? The calcaneus is over the calcaneus, right? Does that feel like that? And then you have to do the medial plantar, I'm sorry. And you have to do your lateral plantar. Just make sure you know where they all are as you're examining on your patient. Okay, lot of nerves here in the foot. In fact, there's more sensory nerves in the bottom of the foot than anywhere else in the body. A lot of things go on there with our feet. Okay? So we've done our temperature and our dermatomes. Next thing we're going to do is we're going to have to do some vascularity here. So everybody remember the dorsal pedices? You're going to come down here. You're going to find the navicular tubercle, and you guys are really good at that now. Just a little distal to it, and then you're going to go medial. Just here's your extensor hallucis right here, and you're going to just palpate it right in here. Right? You're going to take your pulse on each side. You can use one hand, that's fine, I don't care. And then you're going to do what? What's this one?
Tibial.
That's right, the posterior tibial right here. And she has a good strong one on both sides, you can feel it. Okay, next thing we have to do is we have to check the toes for blanching. So you're literally going to do each toe. You're going to blanch it. It should fill within 2 seconds. A little bit slow on that one. 2. I would say that she's pretty normal though. I mean, she's a part of this class, so that's anything against her. Right? You have to go through and you have to do what? Each one. And we should see refilling. Okay? And I sort of glanced over it, probably didn't do it as well as I should have, but when you're doing the temperature, make sure you do the toes. Okay? Sure you do the toes. Okay? So that's how you're going to do your vascularity. What are we doing after vascularity? Bony palpation, right? And you guys have been doing this. So what are the key bony areas that we want to look at with the ankle? Malleoli, the thumb of the talus, the navicular tubercle, proximal fifth metatarsal, in fact, all the metatarsals here, right? And you want to do your calcaneus, right? So everybody, so just go through, make sure, I know you know them, you just want to pick up your key landmarks when you're doing your bony palpation. If you had to do a lot more extensive, like if you thought the patient had something like a stress fracture, then of course you would make sure you came right down the whole metatarsal, okay? Okay, so you're going to do your bony, you're going to do your soft tissue after that. Now this is where you guys have a lot of things you have to cover. All right, now, on the lateral side, we have 3 ligaments that stabilize the lateral side of the ankle. And you all know the anterior tibialis, right? And what else helps to stabilize that? The lateral side. On the lateral side. Anterior tibialis? I'm sorry. Anterior talofibular? Excuse me. Anterior talofibular? That's my job. Anterior talofibular and the what? Posterior talofibular and the calcaneofibular. Can you remember those 3? And so you'll find them on your patient. The anterior talofibular basically comes down, you come to the bottom of the malleolus, and it's just going to go almost straight across. And the posterior one's going to go almost straight across from there, okay? Because that's where your talus is. Just like this. That's where it's coming, okay? This one, of course, your calcaneofibular. Remember, on the lateral side, you always say the ankle bone first. Okay, and the lateral side coming up here, this is where you're going to have your calcaneofibular. So everybody got that? Now, remember those 3, anterior and posterior, talofibular and calcaneofibular, because we're going to look for those exact same 3 on the other side. Oh, and by the way, there's one that comes right up under here and supports the lateral arch. Does anybody know what that is? The lateral arch. And I'm not going to have you guys do this, but you should know it. I probably should add it in. The calcaneonavicular. Calcaneonavicular. Okay? And what's that sister ligament on this side that supports the medial arch? What is it? Spring. And that's the what? AKA calcaneonavicular. Calcaneocuboid and calcaneonavicular. Okay? Yeah. All right? Calcaneocuboid, calcaneonavicular. All right? Now, we also have our deltoid, and that's going to be into 4 pieces. The 4 pieces are the exact same as on the lateral side. Remember we said the anterior and posterior talofibular and the calcaneofibular? Now on this side we're going to have those same 3, only we're going to say tibia first. So we're going to say tibiotalar, anterior and posterior tibiotalar, the tibio calcaneal, and then the last one we're going to have, this is an additional one because we have 4, is coming down here to the what? Tibionavicular. Okay, so let's just go through those all one more time. Okay, remember this one down here supports the arch. What is it? Calcaneocuboid. Very good. And then the anterior and the posterior and the calcaneotibial. Very good. And the spring ligament, another name for that is the what? Calcaneonavicular, right? If you guys say spring, I'm happy with that. That's okay. Now the deltoid, we're going to have 4 heads, right? It's the posterior tibio, anterior, the tibio calcaneal, and the tibio navicular. Okay, has everybody got that? All right. Now we got to do all of these tendons that come down here, and I'm going to try to tell you an easy way to remember them. In the back we have 1. On the lateral side we have 2. Across the front we have 3, and on the medial side we have 4. Can you remember that?
Do that one more time.
Okay.
1, 2, 3, 4. I got it.
1, 2, 3, 4. So how many here? 1,
2,
2,
3, 4.
Okay, so that'll help you. So what's the big one back here? Achilles. Sometimes they'll call that the gastroc tendon, you know, but it's usually the gastroc and the soleus come through here. Now, these other tendons that come along this side, along the posterior side of the malleolus, what are the main muscle movers down here that do plantar flexion with eversion? peroneus longus and brevis, that's right. And it all depends on where the position of the tendon is relative to the malleoli, if it's going to be doing plantar flexion or dorsiflexion. Everybody got that? If it's behind it, what do you think it's doing? Plantar flexion. So the peroneus longus and brevis, they're going to do plantar flexion with eversion. Okay? Now, this will be one way to help you to remember that. If you're running around a track, and you want to win the race, are you better off to be on the inside or the outside?
Inside.
It's shorter on the inside. So guess what's coming up on the inside? The peroneus what? Brevis. Peroneus brevis. Okay? Taking the long way around is the
Longest.
okay? And now that's going to go all the way over under here. But the peroneus brevis, that's the one that comes here. And that's where you can have trouble with that fracture here, if that has a problem. Okay, so on the back, the one is what?
Achilles.
And then the two here are the peroneus close is the what?
Brevis.
And taking the long way?
Longest.
Good. And then we're going to come here, and we're going to come here again. There's another one, the peroneus tertius. That's across the front, right? And that also comes down to our fifth metatarsal, and that helps us to do this mechanism, dorsiflexion with eversion. Okay? Then we have our extensor what? Extensor digitorum longus. And then we have our extensor what? So what are the three on the top? The peroneus,
Tertius.
extensor digitorum longus.
Extensor.
Okay, has everybody got that? So let's go from the beginning. What is this one?
Achilles.
Achilles.
Brevis and longus.
Very good.
Tertius.
Extensor
Okay, so we have 1, 2, 3, 4. No, 1, 2, 3. Now we got to get the 4, right? So coming down on this side, we want to do what? Dorsiflexion with what? Inversion. What does that? Anterior tibialis. So do you think that's going to be in front of or behind the malleolus? It's going to be in front of it. It's going to be in front of it, right? Because it's doing what? Dorsiflexion. Anterior tibialis. And then coming right along here is the what? It's sister, the posterior tibialis. And then we have two coming behind that. You know that what is this retinaculum called? Does anybody remember? Flexor retinaculum. We tap it for what? Tarsal tunnel syndrome. There's a bunch of stuff that goes under that retinaculum, and two of them we have our posterior tibialis. Then we have our flexor digitorum longus. And then the last one here is the flexor hallucis. Hallucis is coming in last. Old Hal, he's so slow, he's coming in last. Okay, has everybody got that? Okay, has everybody got that? Okay, so that's 4 on there. What are they? Anterior tibialis.
Posterior tibialis.
Digitorum longus. And which one's coming in last?
Old Hal.
Hal is coming in, old Hal. And so then we have this flexor retinaculum here. And underneath there, what's the nerve that comes down here, under here, and divides into the plantar, medial and lateral plantar, and the calcaneal? We tap for tarsal tunnel? Tibial, yeah. So you have your tibial nerve, your tibial artery. You have all those things that come under that retinaculum. Very important to have that. Okay? So that's the soft tissue we're going to do. Let's just do them real quickly again. I'm sorry. You guys ready? Okay, so let's do the ligaments first. How many on the lateral side?
2.
Ligaments. Ligaments. Yeah, I'm going to ask you for 3, but there's 4 that we've gone over. We have the anterior what?
Posterior. I thought it was the other way.
Posterior talofibular and calcaneal.
Yeah.
Okay, you with it?
Yep.
Okay, and then what's this one under here that supports the arch, the lateral arch?
Yeah.
Good. Now we're going to go on this side, and we have the sisters of the 3 on this side. We have the what?
Anterior and posterior tibial.
That's right, and the tibio,
Calcaneal.
and then the oddball is the tibio-navicular. Okay, and then up under here, spring, aka
Calcaneal navicular.
good. Okay, then we're going to come back over here, and we're going to come up with all of our tendons. We have a very important tendon here. What is it?
Achilles.
Achilles tendon. How do we test that? What orthopedic test? Thompson, Simmons, right? Then we have coming down here, coming in, taking the short path is the what?
Hernias brevis.
Hernias brevis. Right. And then we have the longer one, taking the longer path is the
Hernias longus.
Hernias longus. Very good. And then we have here, because we have to be able to not only evert but dorsiflex, we have to have a muscle that comes down to here, and that's the what?
Tertius.
Hernias tertius. And this is coming across here with our 3. Then we have our
Extensor digitorum.
extensor digitorum longus.
Extensor house.
Very good. And then on the medial side, now we have 4 over here. We have the what?
Anterior, posterior,
Old house coming in last. Okay? And so any questions about all this? I know it's a lot, but I'm just trying to think of a way to help you guys remember. If you have a better way, that's fine. You don't have to do it the way I'm doing it. You just have to know them all. Right? Okay, so that's our soft tissue. After we do our soft tissue, the next thing is what? What's the next thing after that? That's all we're going to do. We're going to do the rest of it seated. Seated. Okay? So I'm gonna have you sit up here. We're going to do our active, passive, and resisted range of motion. You can do this with the patient supine if you want, or you can have them sit back all the way on the table. Probably be easier and just let your feet hang over. Very good. So our range of motion is going to be what? Right, but they're what? What's our movement? Dorsiflexion, plantar flexion, adduction, and abduction. Right? And so you're just going to control your patient when you do it. Can you just put your foot all the way into it, all the way up? Very good. Thank you. Can you do this one? Good. And can you all the way point down? Good. Good. She did that. That's all right. But you just want to make sure they're doing it controlled. Okay. Can you turn your foot this way? Out this way as far as you can. There you go. Great. And can you do the same with the other one? Very good. And can you now bring it all the way in this way for me? Good. Very good. How about this one? Very good. Okay. Then I'm going to ask you, can you just turn this way? There you go. And then all the way out this way. Good. Very good. And turn this one. Good. And you're doing great. And you're doing great. Okay? So after we've done them actively, we're going to do what? Passive. We want to get more motion out of that. We should get more motion out of that, right? Every one of these motions should be greater. So you'll just have to remember what you're doing when they're moving. Okay, go through all those. And then, of course, the patient's going to, can you pull back? Okay, I'm just doing it quicker here, right? Can you turn them out? There you go. Can you turn them in? Can you just now rotate? There you go, in and then out. Good, okay? And, of course, Dr. Becker says you have to hold it for how long? 5 seconds to see if the patient can resist, and then you try to overpower them, right? You don't have to do that. I mean, I understand that. I understand it, but, you know, if you guys want to, it's okay. After we've done our active, passive, resisted range of motion, is the next thing measuring the calf?
Yep.
Measuring the ankle? I'm sorry. Well, we're going to have you come on down. And so we're going to measure the narrowest part of the, you know, we've always done the widest part. Now we're going to do the narrowest part. And pretty much we're looking for different signs of swelling in here, you know, differences from the side. Doesn't matter which way you do it, except you're going to measure just proximal to the malleoli, and you want to keep it parallel. Make sure that your fingers do not go under your tape measure so that when you come around, you can get a good number. So I got 8 1/4 there. And we want to measure on this side here. Okay, this one's only 8. I want to measure that one again.
Oh, shit. You got diabetes.
No, I must have done it wrong. No. Okay, so we're going to do that. Do what?
Tendon
The tendon reflex. Now, there's a couple of them. One that we're doing differently, I'll get to in a minute, but you all know how to do the gastrocnemius, right? So you can just scoot back on the table a little bit. You can do it just like this. Just pull the foot up like this and then tap. And she didn't get it. There we go. So you can do that in the seated position. Just make sure you push the foot what? In the dorsiflexion. If you don't do that, you won't. There we go. Had to whack you a little bit, huh? Now, this is the one that the boards came up with, and I haven't seen this anywhere else. But it's to test the L5. What nerve was I just testing there, by the way? That's one. But this is one for L5, and it is the posterior tibialis. Have you guys seen that? Have they taught you that at boards yet? Is that where it was? Yeah, it's the only place I've ever seen it. So we know that the posterior tibialis does what? Plantar flexion with inversion. So in order to do this, I'm going to bring the patient's leg up like this. I'm going to then push her foot into dorsiflexion and eversion, because when it moves, it's supposed to go this way and that way. So I'm going to like tension this. And this posterior tibialis is coming right down here. So they always show to hit it just like this. Let this all real relax and look away. And I could feel that actually. She actually went into that motion. Okay? But that's what you're doing. So that's for the L5 nerve root. So you had S1, L5 nerve root. Okay? And of course, all of these muscles and tendons that we're going over, you should know what innervates them. We've gone over them. You should know disc lesions that affect them, and so on and so forth, right? So that's all fair game for you guys on your final, by the way. Actually, it's fair game for you on your boards as well. And it's fair game for you in your office. So after we do that, what's our next thing that we're doing? Just the orthopedic tests, right? And so we've already gone through, we practiced the orthopedic tests already, okay? Primarily they're for stability, but of course gastrocnemius, tendon, you'll want to test that. And don't forget to do like Berger's test for vascularity and so on. Okay, does anybody have any questions? So that's all we're going to do today is we're going to practice that, and